Namaste, I am Gaurav Goyal. I am the faculty of Physiotherapy and Diagnostics in the Department of Diagnostics and Community Health in the discipline of Radiology in Radiotherapy Women's University. Today we are going to discuss a session that is most important for the BScRT second sem student in the Radiotherapy and Hospital Administration in Radiotherapy course. I am from Radiotherapy Women's University, Jaipur. I think this session is very much useful for the these are the sections from to understand the radiotherapy and the uses of radiotherapy and treatment. Okay. So in this session we are discussing about thermoplastic mold preparation. Means mold is used as the surface that is that we are going to select for iso-dose distribution or uniform dose distribution at the surface. Okay. So the most common immobilization devices used to treat cancer is thermoplastic. So okay. So most common immobilization devices is is used to treat cancer in thermoplastic. Thermoplastic it is a thermoplastic material available in different size and shape. Okay, it is according to the surface, according to the organ or part. Okay, it is a rigid in the room temperature. So in room temperature like 27 degrees centigrade Celsius, it is rigid in that temperature. When it's heated in water for temperature 60 to 65 degrees, okay, 60 to 65 degrees, the material soften in that when increases the temperature. When increasing the temperature, material soften and become malleable. Okay, become malleable. Become malleable. When it is wet, it is placed over the patient body and conforms to the contour of the treatment area. Okay. The impressions: head cast, ear impression and nasal impression. Head and neck cast, ear impression and external nose impression. Okay. Chest cast, external nose impression. Abdominal cast, external nose umbilicus impression. Okay. Pelvic cast is used for umbilicus impression. So these are the casts, different types of casts that is used as a thermoplastic cast. Okay. Advantage. So the advantage is thermoplastic provide great reproducibility in daily treatment. It is lightweight and easy to use. Additionally, modification can be made to mask if the patient experienced with swelling or weight loss during the course of the treatment. Okay, the disadvantage of the thermoplastic. Okay, so the disadvantage of thermoplastic cast or sheet is window cut cannot be reused. Window cut cannot be reused, and when old it becomes very soft when activated. Okay, so in this session we can discuss about the the thermoplastic sheet or thermoplastic cast making or thermoplastic mold preparation. So mold, like surface mold, it is used in brachytherapy. Okay, these are the mold that is used to flatten the surface of the part. Okay, it is made up of material, thermoplastic material, or it is melted. It become melted at 60 to 65 degree temperature, centigrade temperature, and the it is a rigid material at room temperature 27 degree centigrade Celsius. Okay. Okay. Yes. So today's session we are going to discuss about the immobilization and radiotherapy. Immobilization means incapable of movement. Radiotherapy is designed very precisely to treat exactly the right area, so it is important to keep that part of the body as still as possible during treatment. Immobilization device is used to make sure that patient stays in the treatment position during the course of the treatment. Means when treatment is being done, then the patient in the treatment house, there is no movement in the patient. Okay, so incapable of movement during the treatment. The role of immobilization, patient positioning, and immobilization are and to be most critical part of the radiotherapy treatment. For accurate delivery of a prescribed radiation dose to a target volume while sparing surrounding normal and critical structures, critical structures. Okay. So for accurate delivery of prescribed radiation dose to a target volume, these are the role of immobilization while sparing surrounding normal and critical structures. Without proper immobilization, the patient is at a risk of improper treatment. So, immobilization is required. It is necessary for proper dose delivery and prescribed radiation dose delivered to a target volume. And the patient is at risk for improper treatment and unwanted side effects. Okay, immobilization such as mold, like surface mold, like cast, headrest, and other devices. These are the devices that is used as a immobilization devices. Okay, so other devices are constructed to reduce setup errors and patient movement during the treatment. Okay, so these are the devices that is used like mold, cast, or headrest, and other devices like dashboard and other devices that is used as a immobilization device. Okay. Uh, uh, Although the primary goal of immobilization system is to limit patient motion and reduce the probability of major positioning error, a well-constructed immobilization system can reduce the time of daily patient setup. Okay, so well-constructed immobilization system, well-constructed constructed immobilizing system can reduce the time of daily patient setup. So there is no requirement of for set the patient daily. So it reduce the time in patient setup. It can make the patient feel more secure and less apprehensive. Means it is also helpful for the accurate treatment of the patient and reduce the side scattered or scattered radiation to the surrounding tissue. It can reduce the reliance on the patient cooperation and alertness, and it can help to stabilize the relation between the external skin mask and the internal structure. Okay, external skin marks. External skin marks are the marks that is on the internal structure like movable structure. So cast or cast is used to uh, to reduce the immobilization during treatment like lungs or any other movement. Desirable characteristic of immobilization devices. It should be transparent. It should be transparent to allow visibility of beam light and optical distance indicator OI. ODI is the optical distance indicator and visible of the beam light. Okay, should be lightweight, strong, and durable. Easy to use. It should be easy to use. Ease of making the device, comfort for the patient. Okay, these are the characteristics that is desirable for immobilization device. Minimal place requirement for the storage. Okay, next one is resistance of bending and stretching. Okay, so minimal perturbation of the beam so as not to produce any artifact in the image acquisition. Uh, the device be usable on simulated CT, MRI, and other treatment planning imaging system. Okay, it is usable like CT simulation. Okay, surface dose should not be altered. Next point is right and hold rigid and hold in its shape over time. Okay, so shape should not be changed. Okay, after time. History of immobilization method. Early days, plastic head cups, standardized neck rolls, cast masking tapes, hold the brick mold 1960-1970, skin mask, plaster of Paris, white blocks, polyurethane forms. These are used. So the next is early 1980 and onward till early 1980 and onward till now or in current laser, base plate, indexer, head support, acrylic mold, thermoplastic mold, vacuum mold. Okay, these are used as a beam modification, immobilization device. Positioning device. All the immobilization device in some sense are positioning device. Okay, positioning devices are ancillary devices which maintain the patient in a non-standard treatment position. Okay, these are the also a positioning devices. Need for a positioning device is set up the patient in a special position designed to improve the therapeutic ratio and patient comfort. Okay, the proximity, the target PTV to the surrounding, a radio sensitive structure. Next one is the optimal beam axis is limited by external anatomic features such as the extremity, a large belly, or a pendulous breast. Material that is used for immobilizing. Variety of material and methods are available for immobilization. The selection of the immobilization depends on the comfort of the patient and preferred by the radiation oncologist. Like plastic of Paris, second is thermoplastic, third one vacuum bed, and last is white block. Okay, these are the material that is used as a immobilization devices in radiotherapy. Thank you. The session is over. This session is powered by digital version 2.0, the AC Vitamin Women's University. I think you all satisfied this session. If you have any query, then put it into the comment box. I will resolve it later. Thank you.